name is Jonah Bosques, and this is Farming with Science. Today we have Dr. Joao Bittar, our extension cattle veterinarian, with us, and today we're going to be talking about the vaccination process and vaccination protocols. This is going to be one of a series of videos that are going to talk about different vaccines and how they work. So today we just want to introduce the concept.
Good morning, Jonah, and good morning, Francisco.
So the background information for everybody that's watching this video is that we have in the Southeast a low adoption rate of the vaccination protocols. So what we want to do is that we want to educate you on how vaccines work, and we also want to stimulate you into trying out vaccines, working with your veterinarian to design a vaccination protocol that works for your situation. And for that, we're going to discuss a little bit of how vaccines work. So let's start talking about immunity, how vaccines help our cattle herd, and how that immunity develops in the animal.
Yeah, vaccination is one of the most important protocol in a ranch. It's one of the cheapest way and very effective way to prevent diseases and to reduce their losses and sometimes even the animal death. So vaccination is a way to induce an immune response in the cattle from a pathogen, from a microorganism. In this case, usually they are pathogens because they can cause diseases. So it's a product developed by researchers, and there are a wide variety of them, in which either contain the pathogen itself in a modified way, or in a killed way, maybe a killed pathogen, or maybe even a part of the pathogen, in which when you give to the cattle, in this case, most of the times it is in an injectable form. It can be intranasally spray as well. So you're showing the cattle immune system that pathogen, and then, or at least that part of the pathogen, and in which will stimulate the immune system of that cattle. So what's gonna do? It's the immune system is gonna create some memory about that pathogen in specific, and then in this way, the next time when these cattle encounter that pathogen, when they get infected, they know each one is it, and then they are able to quickly, very fast, develop an immune response and very specific to that pathogen, in which, depending on the vaccine, you may avoid the infection, it might reduce the infection rate, it may help reducing the clinical signs or the disease severity of that animal.
All right, so Dr. Bittar, what are the essential diseases that we need to watch and use vaccines for?
So the most common diseases in which we have vaccines and the ranchers need to be considered to use, they are divided in two major groups. One is the ones that affect reproduction, and the other one is the one that cause bovine respiratory diseases. And then there's another one, miscellaneous. So, but important for the ranchers to considering, we have those vaccines for some pathogens. So some viruses can affect the reproduction, and then within them we can say the bovine virus, diarrhea virus, also known as BVDV 1 and 2, IBR, that's an infection, bovine rhinotracheitis, that's caused by the BHV1, the bovine herpes virus 1. And then we had some other pathogens, the Campylobacter virus, Trichomonas virus. That's very important in the bulls. We talked about when we are talking about the bull BSE. That's very important to make sure we test the bulls. And then there's a relatively degree of efficacy of that vaccine for the cows itself, not much for the bulls. We have a leptospirosis that's very important, especially here in Florida, because one of the major risk factor is to have standing water, and that's very common here in Florida, so you know better than me. We had a Brucella abortus as well. That's not common here in Florida nowadays, but it was a big issue in the past. There's a vaccine, very effective, to vaccinate only the heifers, and that's only the veterinarian that can give this vaccine because there's a risk of a human infection. So it's a zoonotic disease. When you go to the respiratory disease complex, we have some virus and some bacteria. Within the virus, we have also the BVDV, the IBR, the parainfluenza 3, the bovine respiratory syncytial virus, and we had some bacteria in which you can say the Pasteurella multocida, Histophilus somni, and also Mannheimia haemolytica. And then we also, it's very important to vaccinate about the Clostridium. There are 8 or 9 Clostridiums here. Usually they have all of those vaccine components in one vaccine. That's very important and very cost effective for the producers.
Clostridiums are the ones that cause tetanus in humans, right?
What's that?
Clostridiums are the ones that cause tetanus in humans.
Yes, there's the Clostridium tetani that can be causing tetanus in human, but that's usually is not used in cattle unless there's a risk or a reason for it. That's very common in the horses. And then there's another vaccine in which it was a subject of our previous video. That's the Anaplasma marginale. And another important one here in the subtropical area is a vaccine against pink eye. So it's against Moraxella bovis, bovaculi, and then some strains of a Mycoplasma bovis. That's important because there might be a mismatching of the vaccine strain and the strain in which the cattle are infected. But there are some autogenous vaccines that work relatively good around here.
Dr. Bittar, what about administering boosters? When does the rancher need to administer booster to the cattle herd?
That's an important topic, Francisco, because most of the time, the rancher producer will need to vaccinate the cattle more than once to induce an adequate immune response. Usually, we recommend the prime vaccination. That's the first time the animals are vaccinated. And then within 4 to 5 weeks after the prime vaccination, we recommend to give a booster. That's a second dose of that same vaccine to ensure a better immune response. And that's very important in the killed vaccines because the killed vaccines must have these boosters to induce adequate immune response. And also, there's a variety of immunity duration in which remember me to advise the producers and the ranchers to do the annual boosters because you need to keep stimulating that immune response for the cattle, even in an annual basis.
When it comes to beef quality assurance, can we talk a little bit about administering those vaccines and how we need to be careful in relation to meeting the criteria for beef quality assurance?
So there's a program called Beef Quality Assurance. That's some protocols of best management practice. And then vaccination is one important part of this program. So this program recommends the ranchers and the producers try to do a good job trying to reading the label before starting using the vaccines to make sure they use in the most appropriate way. So if it is an injectable, sub-Q or intramuscular vaccine, it must be given on the neck or behind the shoulder with aseptic techniques using clean and disinfected needles and syringes. If it is in an area in which it's anaplasmosis or other diseases transmitted by blood is endemic, is there, and then the producers want to avoid this transmission of those diseases, recommend to change needles for every animal. So you need to work with your veterinarians to see what is the best protocol there. But usually you need to administrate the vaccine as the manufacturer recommends. You need to store the vaccine in appropriate way, especially the MLV, the modified live virus vaccines, in which are sensitive to high temperatures and also to light. So you must store it in a good cooler with an ice pack, protecting from the light. That's very important. And also, and very important is to check what is the meat withdrawal for those vaccines, because the vaccines, most of them, they have some products inside to preserve them that requires some time for meat withdrawal. So you don't want to put animal in a food chain before that withdrawal time is due. So it's very important to have those good practice to not only get an adequate immune response, but also to have a good beef quality product available for the consumer. So it's very important to work with your veterinarian, especially the local veterinarian, because they are the one that are aware of the most common diseases in your area and in which you have a higher risk, and those that must be try to be prevented through vaccination. There is not one program fits to all the farmers or ranchers, but there's like a backbone of the common diseases in which the producers would beneficiate a lot in vaccinating their cattle. And then according to their management strategies, protocols, how many times the producers are bringing their animal to the pens, then you'll be, the veterinary will be talking and then developing some better vaccination protocols that will fit your operation. But that's very, very important to use vaccines and use in a right way to prevent the diseases, and then possibly reducing the use of antimicrobial. That's a very important topic right now.
So in conclusion, our aim is for you to educate, get a little bit more education on how vaccines work, why they're important to implement in our herd health protocols. And also we want to encourage you to have that relationship, develop that relationship with your local veterinarians. They're a very important piece of this puzzle of protecting our animals and providing our clients with a wholesome quality product. With this, I'm going to thank you, Dr. Bittar, for your time. Thank you, Francisco, for the questions, and hope to see you guys later on another episode of Farming with Science.